Skin cancer is the most commonly diagnosed cancer in all of the United States, but it is a very preventable cancer. It greatly affects the quality of life and it can be disfiguring and even deadly to the patients involved. Medical treatment for skin cancer can be extremely costly for the individuals, for the family, and for the nation as a whole. The number of Americans who have had skin cancer in the past 3 decades is estimated to be higher than any other cancer in the whole United States combined, and skin cancer incidence rates have continued to increase in recent years. Today, I would like to briefly discuss the three main types of skin cancer, the risk for getting skin cancer, and prevention for skin cancer. According to the Skin Cancer Foundation, the following are the biggest risk factors for getting skin cancer. First is being exposed to ultraviolet radiation, such as the sun. Second is not wearing sunscreen. Third is being exposed to the sun without protection, such as long sleeves, hats, and sunglasses. Next is using a tanning bed, and there is a law that they're trying to put out about not using a tanning bed or banning tanning bed use in general for everyone. Now that I've discussed the risk associated with skin cancer and how people get it, I'm going to explain the three main types of skin cancer and what they look like. The three main types of skin cancer, according to the American Cancer Society, is basal cell carcinoma, squamous cell carcinoma, and melanoma. I'm going to briefly discuss each of these. Basal cell carcinoma appears with open sores, red patches, pink growths, shiny bumps or scars, and this type of cancer hardly ever spreads to other parts of the body. The next type is squamous cell carcinoma. Its appearance is scaly red patches, open sores, elevated growth with a central depression in the middle, warts which may crust or bleed. Most commonly occurs in areas that are frequently exposed to the sun, such as the rim of the ears, the face, the lower lip, hands, legs, arms, neck, and balding scalp on individuals. The last type of skin cancer I'm going to briefly discuss is melanoma. It is the most dangerous form of skin cancer and can spread to the other parts of the body, known as metastasizing. Its appearance is, it looks like moles or it can resemble moles, and a lot of times moles do become melanoma. Its majority of the time it is black or brown, but it can also be skin colored, pink, red, purple, blue, or white. Now that you know what causes skin cancer and the three main types of skin cancer, I'm going to discuss ways to prevent it. These are very basic and very easy to do. The National Council on Skin Cancer Prevention provides the following recommendations to help prevent skin cancer. First, apply a broad spectrum UVA, UVB sunscreen all over your body, and especially to the areas that are exposed to the skin exposed to the sun more than other areas, such as what we discussed earlier with the ears, the face, arms, legs, scalp, things like that. You have to do this within 30 minutes before going outside. Reapply sunscreen every 2 hours or more if you're in the sun, and you need to do that more often if you're sweating or if you're in the water or swimming and things like that. Avoid sunlight during the peak hours of 10 a.m. to 4 p.m. Avoid using indoor tanning beds. And lastly, wear some protective garments and accessories such as long sleeve shirts, hats, and sunglasses. Women should choose cosmetics with a minimum of SPF of 15. And the biggest way to prevent skin cancer is a monthly self-screening. There is a tool on the Skin Cancer Foundation website that prints off a body map such as this. What you do is you go through and you mark moles and places on your body that you're concerned about. You write them down, you write down the date, and you write down what they look like. Once that you have established a baseline, if you feel that things have changed or things are concerning, then you refer back to this and you contact your physician or dermatologist and make an appointment to discuss the concerns that you have regarding these things. As I stated, skin cancer is the most common type of cancer in all the United States, more than any other cancer combined. Unfortunately, it is very preventable. It takes persistent precaution and knowing your body and what is not normal for your body. This is key with your monthly skin screenings or self-screenings of the skin. As a healthcare provider, it is my duty to advocate and educate the community on ways to improve their health. And by doing this, we can prevent skin cancer. That is all for my speech. Now I'm going to show you my audience, which is, oh, sorry, that's the TV. Tyler, of course, Lolly, and my mom. So thanks.